Hello, everyone. Thank you for being here today. My name is Tamara Tucker, and I'm the Program Coordinator at the Lifelong Learning Center. As we begin today, I acknowledge that the University of Regina is situated on Treaty 4 territory with a presence in Treaty 6. These are the ancestral territories of the Cree, Saulteaux, Dakota, Lakota, and Nakota, and the traditional homeland of the Métis. This has been an important part of our history and will be equally significant for our future. Today's presentation is called The Importance of Strength and Mobility, Move It or Lose It, The Importance of Strength and Mobility. And Brandy Green is our presenter. Brandy graduated from the University of Alberta Masters of Physical Therapy program in 2008, starting her career in private practice in Regina shortly thereafter. Throughout her career, she has worked in public practice, long-term care, convalescence care, and private practice roles. She's currently working in private practice at ARC Rehab in Regina, as well as running her own in-home physical therapy company, Physio on the Go. So as our presentation gets started today, please ensure that your microphone is muted. If you'd like to have your video on, that's fine. But if you notice that the audio gets sluggish, you may want to try turning off your video to see if that helps to speed it up. If you have questions during today's presentation, please enter them in the chat function, and we will have a few minutes at the end of the presentation to answer questions if you'd like to just turn on your mic to ask at that time. All right, Brandy, I'll turn things over to you. Thank you so much for being here today.
Awesome. Thanks, Tamara. And thank you for inviting me to speak today. And thank you, everybody, for attending today. I was just saying to Tamara before the session started that it's unfortunate that we still can't do these in person, because I much prefer to be able to see all your faces in person and make you actually get up and move. So feel free to do that in your space as we go through some of these things today if you want. Also, I had mentioned to Tamara before the session today that I got a new computer this week. So I'm hoping everything works fine. But this is my first Zoom presentation since getting my new computer. So if there's glitches, I apologize in advance, but I think we should be good to go. So today we're going to talk about the importance of strength and mobility as we age, and the importance of exercise in general as we age, which all of you are very aware of, I'm sure. But I'm going to start with kind of going through a few different things that are important to consider as we age and effects of aging. And then we're going to talk about how we can counter some of those with exercise. So the first thing that we're going to chat about is the maintenance of muscle mass and strength. So one of the most striking things that happens as we age is the involuntary loss of muscle mass, strength, and function. And this is called sarcopenia. So if anyone ever tells you you have sarcopenia, it sounds really like scary and awful, but it's actually just natural aging of your muscle. And we start to lose muscle mass after the age of 30, which sounds really awful as well. To even me, getting close to 40, I've already started losing my muscle mass. So we lose about 3 to 8% per decade after the age of 30. And that rate increases after the age of 60. And that rate varies dependent on your level of activity. But this loss of muscle mass leads to a loss of strength and a loss of functional abilities like walking and climbing stairs and squatting and those kinds of things that are required for daily living. And it can be a contributor and a leading cause of disability as we age. The decrease in muscle mass is also accompanied by an increase in fat mass, because that space needs to be taken up by something in our body, and a change in the body composition, which then can lead to changes in insulin resistance and bone density and joint stiffness and actual structure of your skeleton, which we sometimes see as an increased curve in your upper back, or a kyphosis, that's what that means, or a shortening in your posture that we are always told that you lose inches as you get older. And that's true. We do lose some inches as we get older. And so along with that, that has implications for lots of different comorbidities or different conditions, such as diabetes, heart disease, obesity, and osteoporosis, which can lead to fractures. So losing muscle mass is not ideal. However, with exercise, that loss of muscle mass can be significantly decreased. And so the picture that I'm showing you here, the top muscles there, these are of a cross section of somebody's thighs. So their quadricep and their hamstring muscles is what you're seeing here, but it's like it's sliced right through somebody's thigh. And so the top one is a 40-year-old triathlete. And all of that dark gray is all muscle, and the white is fat on the outside, and the white in the middle is the middle of your bone, and the black is your bone. So all this big gray area is all your big muscle. The second picture is a sedentary 74-year-old. So you can see all that kind of darker gray is their muscle, which is much less than in your 40s, and all that white is all fat tissue or adipose tissue. The bottom picture here is a 70-year-old triathlete. And so again, now you can see that they still maintained all of that muscle mass, and their muscle to fat ratio was very, very close to what that 40-year-old was. And they actually have a bit more muscle density in their 70-year-old than in the 40-year-old because they don't have as much fat coming through there. So you can really affect the changes in your muscle mass and the rate of loss of muscle mass as you age by doing strength training. The second thing that is important when we talk about exercise as we age is the maintenance of balance, your vestibular system function, and your proprioception, which is the way that your brain knows where your body is in space. So vestibular system works through your inner ear. And so many of you may have had vertigo or may have heard of vertigo. And that's when you have a dysfunction in the crystals in your inner ear that causes dizziness and a lack of balance. And that system connects to your brain and tells your brain when you're about to fall or when you're losing balance or going off balance and how to correct it. But as we age, those cells in our vestibular system die off, and the little follicles in our ear start to get stuck laying down, which can affect our ability to A, sense that we're going off balance, and B, be able to send the correct messages to correct that balance loss. So you're more prone to falls if you're having issues with your vestibular system. Blood pressure issues also increase as we age. And so a lot of seniors start to have higher blood pressure and end up being on blood pressure medication. And then your body is not as good at regulating and adjusting for different positions when you have blood pressure issues. So what will happen is sometimes if you stand up too fast, you get lightheaded and dizzy, or if you go from lying to sitting too fast, you get that lightheaded and dizzy. And that's just a big shift in your blood pressure as you change positions, but your body's not fast enough to catch up to that change. And so then you have that kind of moment of blanking out where your body doesn't know, is it sitting or is it laying anymore? Our reflexes and coordination also slow down as we age, which can, again, lead to issues with correcting when we do stumble or fall, that you can't take that quick step to correct, or you can't get that counterbalance through your hips to correct. And then again, that muscle and strength, the muscle mass loss that leads to strength loss that we just spoke about, also affects our ability to react quickly to correct for any balance loss. Again, though, exercise can vastly improve and prevent significant decreases in that balance and vestibular system. So with balance exercises, we see improved step length and step width, which then leads you to be able to clear obstacles a bit better, and also allows you to correct for any imbalances quicker and smoother because you're having a proper step length and width. Whereas as that balance starts to be affected, you'll notice that you start taking shorter steps. You tend to have either a wider base of support or a really narrow base of support. And then you get a bit shuffly with your steps because you don't really trust that your legs are going to be where you think your legs are going to be. And so as that balance and vestibular system get stronger and working better with exercise, that changes. We also see improved functional mobility in that people are able to step up a curb, they're able to climb stairs, they're able to carry objects while they're walking, like groceries or a tray or a bowl or a cup of coffee, able to walk on uneven surfaces, able to get in and out of vehicles more easily, because all of those movements require your vestibular system to work with your muscular system. And so you have to be able to send messages quickly, but also react very quickly. And that's the purpose of the balance exercises, is to teach your system how to react quickly. Which all of this, of course, then leads to a decreased risk of falls, which we all know that as we get older, falls is something that's spoken about a lot, and you almost get a bit of anxiety about falling as you get older because people talk about it so much, and it can lead to lots of illnesses or injuries that end up in hospitalizations and stuff like that. So we don't want to fall. But again, that risk of falls can be significantly decreased by balance training. Next area that we want to make sure that we're maintaining as we age is the maintenance of flexibility or prevention of stiffness. So as people age, their joints are affected by changes in the cartilage and the connective tissue, and you don't have as much fluid in those tissues, so they're not as pliable. So they're like an elastic band that starts to get dried out. It's not as stretchy as it used to be. It's a bit more frail and a bit stiffer. And the cartilage in your joint starts to wear down and get thinner, which is actually what causes osteoarthritis. Is when those joint surfaces start to break down, you start to get inflammation on those joint surfaces, which leads to pain, and that's what osteoarthritis is. So as that cartilage breaks down, those joint surfaces don't slide as well either. So you'll start to notice that you don't have as much range of motion in that joint as you used to have. You can't straighten your knee all the way, or you can't bend your knee all the way, or you can't reach that shoulder up over your head. And that's because those joints just aren't gliding the way that they used to. Although a feeling of stiffness and decreased flexibility is often reported as we age, the true loss of joint flexibility is quite small. So this is really one of those areas in our body where we do see physical changes as people age, but those physical changes actually don't result in a significant limitation. It's more that we don't use it because it kind of feels stiff and sore. And so the less that you use that range of motion, the less you have that range of motion. So this is definitely one of those areas of mobility that is, if you don't use it, you lose it. And we see this a lot, especially in shoulders. So as people age, they just don't have as many activities where you reach overhead, and they start to lose that range of motion. So they move things lower so they don't reach overhead more, and then they can't reach overhead. And so that is definitely one of the areas we see. The other joint that I see a lot is hips and knees, that we just don't get into a deeper squat, or we don't get into a full knee flexion anymore because we don't have a reason to. And then we lose the ability to do that. And then it feels like it can't go there anymore because it hasn't gone there for so long. So this is definitely one of the areas that's very important to maintain as you get older, because it is one of the most preventable losses. Whereas some of those other ones really are physiological changes that you are battling. You're basically fighting uphill on the muscle mass, and the next one we're going to chat about is cardiovascular. But flexibility, you definitely can maintain because your physiological loss is not as apparent. So by doing flexibility exercises, we see decreased joint and muscle pain. And quite often the pain is what limits the mobility, not necessarily the joint movement itself, but what the joint movement feels like. So if we can decrease that pain, that mobility is usually pretty good. Again, we also will see improved functional mobility. So picking up objects from the floor, reaching outside your base of support to open or close a door, reaching overhead into your cupboards, like I mentioned, those kinds of things. And then because that ease of movement is more comfortable, these types of exercises also have the potential to decrease fall risk because, again, you're more pliable as a person. And so you can reach out and grab the railing, which you maybe wouldn't have been able to reach because you weren't as flexible. So it's really important to maintain your flexibility and really thinking about what is the range of motion of my joints, and am I using it on a regular basis or not? Or am I only using it within a small range of what's actually possible? And how could I make myself use that range a little bit more? So as I mentioned, the next category that we see age-related changes in is cardiovascular health, which again, I think everybody is pretty aware of that cardiovascular changes are quite common and that you can combat them with aerobic exercise. And so the age associated decrease in aerobic capacity is about 3 to 6% per decade for your 30s and 40s, and then greater than 20% per decade after the age of 70. And that's without any cardiovascular disease. So that's like a healthy heart, you're losing this aerobic capacity. And again, this is one of the ones that we really can change by using it. And that after 70, that significant decline is often related to a lack of use of our aerobic capacity. By 2030, approximately 20% of our population will be age 65 or older. And in this age group, cardiovascular disease will result in 40% of all the deaths. And it is still currently, even with COVID, which seems shocking, the leading cause of death in older adults. One of the key issues noted, though, is that this decrease is often associated with lack of use. So this is another very much use it or lose it category of health, because as we age, and especially after retirement, people often do take on a more sedentary lifestyle. And this is even just thinking about your activities of daily living. When you're working, you get up, you shower, you get out of the house because you have to go to work. So you get in and out of the car, you walk from the car to work. We do have very sedentary jobs for the most part lately, which has really impacted cardiovascular health in everybody. And that is why we're seeing a bigger decline in the 30s and 40s as well, is that our lifestyle in general is more sedentary. But as we get retired, you don't necessarily have to leave the house every day. You don't necessarily get in and out of your car. You don't necessarily walk that block or half a block in and out of your office building. Sometimes you have other health conditions at that point in your life where you don't even do that when you go out to get groceries. You get dropped off at the door, or you have somebody assist you with getting those kinds of groceries. So our lifestyle can become very sedentary when we take away work. And we see that as an increase in that loss of aerobic capacity. So again, there's significant impacts of exercise on your cardiovascular system. So increased levels of physical activity are not only associated with a significant reduction in that cardiovascular mortality rate and the morbidity rate, which is illness related to cardiovascular conditions, but also on the whole rate of aging in the absence of disease. And what that means is that it allows you to have a longer healthy lifespan or life expectancy. So in the research now, they're starting to differentiate between life expectancy and healthy life expectancy. And a healthy life expectancy is living with minimal illness and disability, basically. And so cardiovascular exercise is one of the key factors that increases your healthy lifespan. The heart does undergo important changes with exercise, even in older people. So this happens with younger people. If you're a sedentary young person and you take on cardiovascular exercise, you will see these changes as well. Your heart will grow like any other muscle. It is a muscle. And it changes like a muscle will change. So you can build strength in it, just like you can build strength in your other muscles. And this will also help improve your lung capacity, which often declines as we age as well, because we just don't, again, have as much force of taking deep breaths throughout our day when we're not being as active. So increasing cardiovascular exercise will increase both your heart strength and your lung capacity, because it will force your heart to beat harder and you to take deeper breaths. But what we do see is master athletes in comparison with age-matched control subjects. So these are older master athletes. That's what master athlete means. I'm not sure if you know that, but when you hear master athletes, it usually means senior athletes. They demonstrate increased wall thickness, so bigger muscles, bigger end diastolic volume, which means they're able to pump more volume out of their heart with every heartbeat, bigger stroke volume, and bigger cardiac energetics. So they have more ability to respond quickly with heart contractions than non-athletes. and they have reduced end systolic volume, which means that they don't have as much fluid left in their heart after the beat is done. So with your heart, you want as much blood to pump out every beat as you can. So you get the blood pulling in and the blood pushing out, and you want a good functioning heart will pump out most of the blood that came in, because you don't want blood sitting in your heart. You want it circulating to all of your muscles and your brain and your organs. And so the cardiac functional testing is significantly improved in an athletic population versus their age-matched norms. So again, you can create a lot of change in the aging of your heart and lungs just by doing cardiovascular exercise on a regular basis. So all of those components impact our ability to perform daily tasks, such as dressing, bathing, walking, house cleaning, cooking, driving, all of your regular daily activities. And all of those daily activities are actually what lead to the need for increased care or the loss of ability to live independently if you're not able to do them. So those are what they would assess in the hospital. Can you do these things? If not, I can't send you home. And so the importance of maintaining all of those components of health are not only to keep your body healthy longer, but also to keep you living independently and taking care of yourself and living in your home much longer. So I also wanted to talk a little bit about the impact of culture. So up until now, I've mentioned a lot of age-related changes in the structure and the physiology of your body, which is true. But we do see differences in different cultures in mobility. So although we see a loss of muscle mass as we age, a loss of cardiovascular function, a stiffening of joints, those things, it is very dependent on lifestyle. And we can see that in how different cultures continue to move as they age. And so in lots of Asian cultures, they're able to maintain their deep squat, like this lady over here, because that's actually how they go to the bathroom. And so they deep squat like that from childhood throughout their entire lifespan. And when I look at many of the seniors and even young people that I know, many of us cannot deep squat, and we're in our 30s and we can't deep squat, let alone in our 70s or 80s. But this demonstrates that your hips and knees can maintain that mobility for that long if you use it. Same with our cultures that focus more on daily prayer. They are able to get into that deep kneeling position on the floor into their senior years. And again, that demonstrates ankle, knee, hip, back mobility, as well as balance and strength to get on and off the floor. Similar to our cross-legged positions in different cultures, being able to sit on the floor cross-legged is something that most North American people cannot do as they get older, because we don't do it. We are taught to sit on furniture, and getting on and off the floor becomes a very challenging thing as we get older, because we just don't do it. And we haven't done it for so long that we become afraid of it, because we're not sure we're going to be able to get back up. And so even just practicing getting on and off the floor on a regular basis is an important way to kind of monitor your functional mobility as you get older. The last one I wanted to touch on was stairs, because that's something else that I see often as people get older, and especially with hip and knee arthritis being so prevalent in our society, that stairs become another thing that is very challenging and often creates a lot of fear and anxiety in people as they get older. And one of the reasons is because we don't do enough stairs. And so one of the things that we see as people age is that they tend to downsize out of their home into a condo or into a bungalow, where maybe they have to do 1 or 2 stairs to get in, but once they're in, there's no stairs in their house. And really, unless you go looking for stairs, you don't come across them that often. And we see in European cultures, they climb stairs forever because their whole world is stairs. They walk to the market every day, down a big hill of stairs like this, and back up a big hill of stairs, carrying their groceries back from the market. And that's just not something culturally that we're used to doing in North America. The last one is walking. So again, in many European cultures, many people don't own cars or don't drive cars. And so they walk their entire life. And like I said, they'll walk, half an hour to the market and half an hour back every day. because that's what their culture has taught them to do. And that's what they've done their entire life. Whereas in North America, we typically get a car when we turn 16 and we drive our car everywhere we go from the point that we're 16 on, and we have to make an effort to walk. We go out and we walk with our friends, or we walk for exercise, or we walk in the park, because we don't walk in our regular life. And so the difference of even parking a block away and walking that extra block can be huge when walking is not something that we typically incorporate into our daily life. So some of the functional indicators of mobility that you can kind of use in your own world to kind of test, how am I doing? Are these things I can do easily? Are these things I can't do easily? Are these things maybe I need to start practicing doing a bit more often so that I don't lose them? Are these. So one of them is climbing stairs, which I've already mentioned, and getting up from the floor. Getting up from the floor, if you're worried about it, there are lots of videos online to show you how to get up from the floor. But usually you would start doing it beside an object that you can help push up from, and then progress to being able to do it without something to push up on. Being able to pick up objects from the floor without support, or do you have to hold on to the counter to pick something up from the floor? Being able to carry your groceries while you're walking. Can you carry a bag of groceries and walk from your car to your house? Or do you lose your balance, or do you feel unsteady doing that? Being able to lift light objects over your head and into a cupboard. Can you lift plates up over your head into a cupboard? Being able to get in and out of a bathtub. Can you step over the edge of the tub and get in and get back out? Being able to get in and out of bed. How do you get in and out of bed? Do you crawl in? Can you lay down and pull your legs up? How are you managing getting in and out of bed? And is that something you're going to be able to maintain as you continue to get older? And your ability to walk greater than a block at a time. So those are just some functional indicators of important things that you need to try to stay able to do as long as you can. There's a couple easy measures of mobility as well. And so one of them is the timed up and go test, or the tug test. And in this test, you basically start in a chair, and well, first you have to measure out 3 meters in front of the chair. So you have a chair, you measure out 3 meters, you say go, start the timer, you stand up, you walk 3 meters, turn around, walk back, sit down, and stop the time. So I have a little video of that for you.
When I was a student, I'd write long essays.
Just let me change. I think I have to do this. There's an ad first.
That I'd work on for days, but now I'm writing short emails and messages all
against the chair.
Okay, so I'm just going to turn the volume off because I don't know if you can have volume anyways, but this is what it looks like. So you'd start in the chair, you just stand up, walk your 3 meters, turn around, come back, and then sit down. Okay, the goal is to try to be able to do that without your hands. But some people can't. So if you need arm rests, start with arm rests, and then that would show progress if you could do it without your arms as you get stronger. I've included in the PowerPoint here just some norms that would indicate fall risk by population for the timed up and go. So if it takes more than 12 seconds to complete that timed up and go, you're at a higher risk of falling. For general community dwelling adults, so that's like regular older adults, it's about 13.5 seconds would be a higher risk of falling. So if you're kind of a bit over 12, you might have a low risk of falling. If you were 13 seconds or higher, you have a higher risk of falling. If you had a stroke, if you're over 14 seconds to do that test, you're at a high risk of falling. If you're frail elderly, I'm not really exactly sure what defines that in this case, but usually that means like older and unhealthy, like in their late 80s or 90s and unhealthy. Amputees, 19 seconds, Parkinson's disease, 11.5. So they're actually quicker usually because they have a quick pace. Hip arthritis, often you should be able to do it quicker than 10 seconds, and vestibular disorder is about 11 seconds. So those are just some indicators that you can use, and it's an easy test to do at home on a regular basis, once a month or once every couple of months, to see, hey, how is my mobility? Am I doing pretty good or not? Another quick test that you can use at home helps test your functional aerobic capacity and strength and endurance. And it's a 4-minute or a 6-minute walk test. And so these ones, you would measure out a length of hallway or sidewalk, and then you would walk back and forth along that for 4 minutes or 6 minutes, whichever you decided you wanted to do. And then track how many times you did it and times that by the distance, so that you had your distance of how far in distance you were able to walk in 4 minutes or 6 minutes. And then you would use that as kind of your baseline, and then measure again as you got stronger and better or worse. And your comparisons would be to yourself. So a small meaningful change would be 20 meters. So if the next time you tested, you were able to walk farther by 20 meters or less by 20 meters, that would be a small significant change, meaning that scientifically and statistically, you've either improved or diminished in some capacity. A big change would be 50 meters. So that would indicate that you have actually had a significant, meaningful change in your mobility, either for the better or the worse, depending if you were able to walk farther or less far by 50 meters. So I just like to give you guys those, and I probably would have made one of you guys do the timed up and go if we were in class, but they're easy, quick ones that you can do on your own at home to kind of just test yourself and see where you're at. So again, the components of fitness that we talked about today are mobility or flexibility, range of motion, balance, strength and muscle mass, and cardiovascular health. And so I've created a little bit of an exercise program for you guys that we're going to go through in a minute here, that we'll email out to all of you guys. So you have it, that just touches a little bit on each category of health and fitness that you guys can use on your own if you'd like, and just have it as a tool that you can look at and say, hey, have I done any of these? Do I do any of these on a regular basis? Or how am I working on each of these components of fitness? The other thing I wanted to the exercise program is just the importance of deep breathing and breath work. And so I touched on this a little bit when we talked about the cardiovascular health, but what we do see often as we age, and I mean, we're seeing this even in very young populations now because of our sedentary work and lifestyle, is a diminished lung capacity and diminished lung health. And that's because we don't use our lungs all the way. And lungs are very much use it or lose it organs. So if you're only taking shallow breaths, you're only using your upper lung lobes, and you're never using your lower lung lobes. If your lower lung lobes get full of fluid, that's what pneumonia is, and that can cause a lot of problems. So being able to take nice deep breaths and using and pushing that air through all of your lung lobes is very important. So this is something that everybody should be doing daily, at least 3 to 5 deep breaths with a good inhale through your nose, hold for a couple seconds, deep exhale your mouth, try all the way out. So you want to fill the lungs all the way, and you want to empty the lungs all the way. And this can help with lots of things, not only lung capacity, and it works very nicely for stress management. It helps calm anxiety. It'll help calm your nervous system. So if you have a nerve condition like stroke, MS, Parkinson's, or even some, like they are including breath work in lots of the Alzheimer's and dementia patients now, because it increases that oxygen to the brain as well. So it can be a very useful tool, and it's just an important part of your health that you should also try to incorporate daily. So before we go into the exercises, I just wanted to touch on the most important thing is to do it. So move often. The more different types of movement that you can do, the better. Choose activities that don't aggravate your symptoms, your pain, your ailments, your vertigo, whatever it is, because then if they aggravate it, you're not going to want to do it. And it's not going to be helpful, because then you're not going to do it, because then you're going to create this kind of like fear of activity, because every time I do it, it makes my knee hurt, and then my knee hurts for a week and I can't do anything else. So trying to choose activities that are good for your body. And there's lots of different kinds of activities. So if one doesn't work, try something different. And the last tip is stay hydrated. So what we see lots as people start into an exercise program is they stop doing an exercise program because they start to have increased stiffness or cramps or soreness after exercise, or they feel gross or they get nauseous. And most often that's because they're dehydrated. So drinking lots of water is equally important to exercise. The recommendation is generally about 1.7 liters of fluid per 24 hours. Any caffeinated fluid does not count in that fluid count. So if you are drinking coffee or caffeinated teas or pop, that is not fluid. So trying to keep that in mind as well. And knowing that if you have been sedentary and you start being active, soreness is part of that to a certain extent. You will have some muscle soreness, and that's your muscles growing and changing, which is good. But we want it to not be to the point that you're not going to want to continue doing it. And typically, if you have some post-exercise soreness, more exercise is what will fix it, which is a bit counterintuitive because you think, ooh, I feel a bit sore from what I did yesterday. I think I should take a day off. But if you take a day off, you get more stiff and sore. And if you move, your body's like, oh, this is what we're doing now. And it kind of re-lubricates all those joints and gets the blood flowing through all your muscles and will loosen you up. So if you're feeling stiff from an activity, do a light activity the next day and it'll make you less stiff. Okay. So I'm just going to switch again. I know we have a couple questions here. Oh, does milk fit into the water category? So milk would, yeah, milk is a fluid that would fit in. Juice, yes, but juice has a lot of sugar. So you got to be careful with any kind of juices, just nothing that's caffeinated. So coffee and tea would not, but milk definitely would. Okay. So in the handout that we're going to email to all of you guys after the session today, I've broke it down into those different categories of fitness for you so you can kind of think about it. So for cardiovascular fitness, you want to try to do at least 30 minutes of cardiovascular activity every day. And that doesn't mean that it needs to be intense cardiovascular activity, but it just needs to be moving your body. And it doesn't mean that it needs to be all at once. So you can break it down into 10-minute sessions. So if you're like 30 minutes, I can't walk for 30 minutes, do 3 10-minute sessions or do more 5-minute sessions. And so cardiovascular health, you want to be doing something that's going to get your heart rate up, and you want to be doing something that is getting your breathing rate up. So that's making you breathe a little bit heavy. And as we get older, our maximum heart rate does decrease, and your maximum heart rate can be calculated as 220 minus your age. And then you typically want to stay in about 60 to 70, definitely below 75% of your maximum heart rate. So 220 minus your age times 75% is about where you want your heart rate to go. So the exercises I've included in here are like walking, stair climbing, swimming. Biking would be a good one if you like biking. These are just some options that you could do. I tried to pick things for this program that you could do from home, although swimming is not really something you could do from home. But I tried most of them to be ones that you could do in your own space. The next category is strength. So the ones that I've included in here are a sit to stand, which is the beginning of a squat, and is typically where I would start most people. But if you're feeling strong and you can do squats, squats would be the same as a sit to stand. But sit to stand is a very functional movement that we do tend to lose. And so trying to do sit to stand without using your arms is the idea there. A clamshell works the muscles in your bum that help with your balance. Bridges help work your bum muscles and your core muscles. So again, very good for balance and for functional strength in getting on and off a toilet, those kinds of things. Wall push-ups will work your shoulders and your chest, but also your core because you're having to kind of hold yourself up there. So again, good to help promote that balance, but also working your big chest muscles. Tricep dips are useful because they are the muscles that you would use to push yourself up out of a chair if you needed to push yourself up out of a chair. So keeping them strong is good. And for all the ladies here today, this will help with the chicken wings that we get as we get older too. So these are the ones that help keep those back of the arms nice and firm. And then rowing. So rowing is actually an upper back exercise. And this one you would need a band to do, or you could do with like light dumbbell weights or heavier dumbbell weights if you're strong. And the idea is that you're squeezing your shoulder blades together to create that movement in a row. So this is an upper back strengthening exercise, which is very important for maintaining posture as we get older. The last one in the strength category is the shoulder Y. And this one, you put your hands on the wall and then you keep your hands on the wall, squeeze your shoulder blades back and try to move your hands up the wall. This works on, again, upper back and posture strength, but also working on maintaining that shoulder mobility as we get older. Then I have some balance exercises in here. I actually did a whole balance presentation for lifelong learning a couple years ago. And so didn't focus as much on balance in this one, but balance is definitely a key exercise that's important as we get older and is something that you should try to incorporate at least one balance exercise into your day every day. So here I have a forward reach, side reaches, and these are the balance exercises I included in here are kind of like progressively harder. So start with the first couple. If they're easy, then progress down as you go because they get harder as you go. Standing on a tightrope, tandem standing, working on standing on one foot, and then standing on one foot, doing clock reaches to different spots on the clock, and then doing standing on one foot, trying to move your arms. Whenever you do balance exercises, make sure you do them close to something that you can use for support. So either standing beside a wall or standing at a counter so that if you need something to hang on to, it's there because we don't want to create injuries when we're trying to prevent injuries. And then the last section is flexibility. And so in this section, I just included general stretches for each major muscle group. And so the hamstrings and the calf muscles are probably the ones that I see the most tightness in as people get older, as well as the hip flexors. And so the first one here is the hamstring stretch, which is the muscle on the back of your leg. We all have seen that one lots, I think, throughout our lives. And then this one is stretching your big calf muscle. This one's stretching your lower calf muscle. And then this one is your hip flexor stretch. So just letting that leg hang over the edge of the bed to get a good stretch in your upper thigh. The other muscles that can be inhibitive to function and movement if they get too tight are your pectoral muscles, which are your chest muscles. And that'll lead to that rounding in your back and that closing of your chest and limiting your shoulder range of motion. So this one is just working on stretching out those pec muscles and trying to get that chest opening position. And then the last one is also a chest and a bicep stretch there. Then I put in some neck stretches because again, we don't typically use our full neck range of motion as we get older. And where we see that inhibiting people is being able to shoulder check when they're driving. Same with your thoracic and upper back mobility. So I included a bit of all of those for you guys in there, and all of you will receive that handout after the session today. Okay. So that is all I had to talk about. I fit her in, I think. So I think we have some time for questions now. We have about 10 minutes and I'll maybe turn it over to Tamara. Did you have any questions come at you? I didn't see any more in the chat.
I don't see any more in the chat, but if anybody would like to now enter a question into the chat or just turn on your mic and ask Brandy directly, you're welcome to do that. Thank you so much for all that wonderful information, Brandy. Wow.
No problem. I know it's a lot. I talk fast too, so I apologize.
Yeah. No,
How do you
wonderful.
start when you've been in a sedentary kind of position for about a year?
So I would typically start with walking because walking is typically the most functional, the most important, but also you can moderate it the most. So you can start just even walking in your own house if you have a hallway or around the kitchen table where there's support if you need it. So you never get too far from a chair that you need to sit in. And then actually when you have to sit lots, it helps because you have to do more sit to stand as well. So that helps build up your leg muscles. So if you're walking and you feel like you have to sit lots and you're like, oh, why am I even doing this? It's not getting better. Remember that every time you sit down and stand up, that's also doing a strengthening exercise. So does that help, Milan?
Yeah. Sorry, it's Sheena. I forgot to change the name. It's my husband's name on the thing. I've also signed up for the beginner yoga class to stretch the muscles. Is that a good idea?
Yeah, that's a very good idea, because that will, again, work on getting that joint mobility back, which will make it easier to do lots of the other things. Because lots of times if you've been sedentary for a long time, everything just feels like it's stuck almost, right? Like you can't, all your joints feel stiff and tight and your muscles are stiff and tight and weak. And so, yeah, yoga, chair yoga especially, is a really good place to start because it'll get you moving, but it's not too intense that it's going to feel harmful.
Yeah. Okay. Thank you so much.
Yeah.
Thanks for the presentation.
No problem.
There's the comment here that just says, that was great. Thank you very much. Great reminders for so many things that we use daily. Heather's asking, do you have suggestions for increasing mobility in hands with osteoarthritis?
Sure. So osteoarthritis loves heat. So one of the things that works really nicely if you have a lot of pain and stiffness in your hands is actually those hot wax things that they used to have for like the spa. Those work really nicely. Or even just like an electric heating pad that you can wrap your hands in before you start doing any of your exercises. And then there are several like hand mobility exercises that you can do that work on each of the different joints in your hand. So if you're having a lot of difficulty with that, it probably would be a good idea for you to see a physio to just get you started on like what exercises are important for you and what do you want to be able to do with your hands, right? Like, are you somebody who likes to knit or crochet, or are you somebody who just wants to be able to cut your food by yourself? So those are different levels, right? So there are lots of options for hand mobility and lots of options for arthritis. The other thing I would recommend trying if you have a lot of pain and stiffness is acupuncture in your hands if you're open to it. It works very nicely.
There's another question here from Ev. She says, is there a better way to get up off the floor and to get down onto the floor?
So usually the getting down is easier than the getting up, although it's a bit more scary. And so typically I would start people beside the couch with a good like armrest on the couch, that then you would kind of scoot your bum to the edge of the couch and then put one knee down and then put the other knee down and then bring your bum down. And then to get up, you just kind of do the opposite thing. You scoot close enough to the couch that you can hang on to the arm, and then pull your bum up so you're kneeling on both of your knees, bring one knee up, and then push up onto the couch. Now, some people can't kneel because their knees hurt or they have knee replacements and it's uncomfortable to kneel on them, in which case you might want to put a pillow under your knees. And that would, because you really pretty much need to kneel on your knees to get up and down off the floor for at least a little bit, unless you're really good at squatting, which most people as we get older just aren't. Like I said, unless you came from a culture that's really good at squatting. Most of us stop squatting that way when we're 5. So
another comment just says, excellent presentation. Thank you for the handouts. Any video recommendations for seniors?
So that was Val, like exercise video recommendations or like exercise program. Yeah. Oh, that's a good question because there's so many out there. I don't know that I have any specific ones that I would recommend. I think anything that is labeled as like strength and balance for seniors would be one that I would look at. There's quite a few that are actually run by physios on YouTube. And what's that girl's name? Dr. something. It's a woman and her name is Dr. or something. And she's a physio out of the States. And she does all kinds of like strength and balance videos and for seniors. And she's quite good, although she likes to talk a lot, like me. But I would say probably the key thing I would look for is the wording like strength and balance for seniors. If you're mobile enough to do that. If not, then I would start with a chair yoga for seniors.
And we have a great option this winter called Ageless Grace, which is a seated program. And so that's a really good one. And the yoga multi-level is also a good one if you're wanting to be able to do it from home. That's going to be remote. And Tai Chi Cha actually would be another. They're all very low impact. I see another question here. Will the presentation be sent with the exercises? I missed this. Oh, would you be open to me sending the PowerPoint that you
Yep.
prepared in a PDF? Okay.
Yep,
So
for sure.
what I'll do is I'll send that along with the exercise handout, and I'll send it through CCE Community. So you'll, the same way that you logged into the session today is where you'll find the handout sent to you. And excellent motivation. Someone said they're going to share these exercises with their sister who had a stroke.
Yeah. That's great.
All
I'm glad.
right.
I'm glad to be helpful. I'm glad that that you found it helpful. So hopefully it will be in your daily life.
Mhm. All right. Are there any final questions before we wrap up our session here?
No, but that was very good. Thank you.
All
Randy,
right.
have you taught other classes to people of our age previously for the Lifelong Learning Center, or?
I did. I think the last one I did was also a Wellness Wednesday, I want to say, and it was a few years ago. It was when we were still meeting in person, and I did one on balance that day. And I also did a similar one on balance and fall prevention at, it was for another healthy aging group in the city here. So yeah, I've done a few, but I mostly just do it when they ask me to. and then I ask them what they wanted me to teach. So if you have things that you would like to learn that you think that I could teach you, I'd be willing to do more. But
Yes, please let me know. We're happy to invite Brandy back again. All right.
And so you're going to send out the exercises, right? We don't have to, you just know who signed up and, okay,
Correct.
good.
Yep. Since you
good,
registered for the session, I'll be sure to send it out.
Okay, thank
And
you very much.
a couple more thank yous here in the chat. And I think that's all for today. All right. Thank you so much, everyone, for being here. If you want to check the chat, I did put the link in there for the upcoming Wellness Wednesday presentations, as well as our fitness courses. Courses for winter term are beginning on January 24th. So please register as soon as possible, so we know who's interested in taking what.
Okay, I'm
All right.
interested in the multi-level yoga. So I just go on the link. Is that what I do?
You betcha.
And that is Zoom, correct? Or
That one is by Zoom. Yes.
okay, and then you just pay by
Just register online. Yeah. And if
register
you,
online.
if you need any help registering, I'm going to put Student and Instructor Services number in the chat function here,
Okay.
585-5748. And that information is also on our website.
Okay, I will do that because I would like to do the yoga multi. Okay, thank you.
All right. Thank you
Okay.
so much, everybody. Have a wonderful day.